Let's talk about preventive measures. Even though I didn't ask you what the causes and risk factors are, I guess while speaking, you've been able to establish the causes and the risk factors. So very quickly, let's talk about prevention now.
The prevention I'll discuss it in 3 ways.
Okay.
Prevention includes avoiding the disease. That is 1. 2, vaccination. 3, there's something we call prophylactic treatment. Prophylaxis means something you take to prevent something that you feel might happen. You understand what I'm saying? So the vaccine and, I mentioned 3 things. The vaccine and the, what's it called now?
You talked about the prophylaxis treatment.
Is more of people who do not live in the endemic areas, in the typhoid endemic areas, but are traveling to the typhoid endemic areas. So for the vaccination now, there are 2 types of vaccines available. There's the tablets, which is the live attenuated vaccine, and there's the single shot injection, which is the dead vaccine. You understand? Now for the live attenuated, the tablets, you use it 4 tablets every other day. But your last dose must be a week before you travel to an endemic area. That is for the tablets. While the vaccine is just a single shot that must be taken 2 weeks before going to an endemic area. Now, since the tablet is a live vaccine, it is not encouraged for HIV patients to take it. They should rather go for the what's it called? Injection, which is the dead one. You understand what I'm saying? So for what's the other thing I mentioned? Prevention of, the prophylactic treatment. Now, if someone is going to an endemic area, doctors might recommend antibiotics, and an antibiotic maybe for 5 or 7 days before going there. The usual antibiotics that they recommend is the ceftriaxone. The most popular brand is the Rocephin. I'm sure you've heard of Rocephin. Ceftriaxone or azithromycin. Azithromycin has been, and azithromycin. Azithromycin has become very popular because of COVID. You understand? You can also use it with the ceftriaxone to prevent, for prophylaxis if you're traveling to an endemic area. Then the most important thing is avoiding the infection itself. Now, I don't think there's anything you can use to substitute provision. This one is to the government. Provide potable water, clean potable water for your citizens. There's nothing that can substitute that. Provide potable water, good drainage, and good sewage disposal systems for your citizens. It is their right and it is your duty to provide that for them. Now, for the citizens, do not defecate indiscriminately. Even if the government is here to provide those systems for you, you be neat for your own sake. You dispose your waste products and especially your sewage properly. Do not defecate beside streams. No, do not defecate. Even if you have to defecate inside a stream, do not defecate upstream. Rather, you defecate downstream. That's the practice. And even if you must defecate near a stream, there is a distance from the stream that you cannot go, so that the stool will not go and contaminate the water. Go for bottled water, preferably bottled water, preferably the carbonated ones. For those who cannot afford bottled water, boil your water for a minute. Now, I did not say heat the water for a minute. I said boil. So when the water starts to boil, you then wait for a minute. You can see there's a difference between heating the water for a minute and boiling it. Water has to reach the boiling point of 100 degrees or whatever, and you wait for a minute before taking it off. Do not eat indiscriminately at food stands. Local food stands everywhere. You see someone just set up a store, you see the pots and everything behind them, and they start serving. Do not eat those kind of food. Indiscriminate eating of those kind of food is dangerous. But if you have to eat them, you only eat such food when the food is hot. Do not eat cold food from a food stand. Now, 3, if you are to take drinks like you know, alcohol, the cocktails, the wine and everything, you know, commercially, do not take ice in them because you don't know how they handle the ice. You don't know whoever it is that is putting ice, you know, give me so on the rocks. Give me vodka martini on the rocks. It sounds nice to say, it sounds posh and everything, but those rocks that they are putting inside your drink, you don't know if it's a typhoid positive, a typhoid carrier that is handling your rocks, you know, before you have your world rocked by typhoid. You understand? Now, the risk factors. You mentioned something about risk factors.
Yes, please go ahead.
For people who own establishment where food has to be sold, or where people own food business, they should endeavor that they take stool cultures or blood cultures from their workers to test for typhoid. Like I said, even people who have been treated, who no longer have the symptoms. What do you mean by a carrier? Is someone who has the pathogen. You know, a pathogen is a microorganism that causes disease. You understand? It can be virus, fungi, parasite, or bacteria. In this case, Salmonella typhi that we're talking about is a bacteria. So for people can be treated and no longer have the symptoms, but still have the bacteria in them. You don't know how the person behaves at home. Maybe it's one. I've seen a lot of adults that will go to the toilet and will not wipe their butt and just come out like that. That happens a lot. That kind of person will come and shake you. You understand. And the way, you know, people shake a lot in Nigeria these days. You don't know where that person's hand has been. You get. So someone can even clean, someone can clean their butt and not clean it properly, and then scratch a bit here and there, and they will still come and shake you. You know, there are so many ways that those people, let me not say those people, that's stigmatizing them, that carriers can infect you. Now, people who are in the food business, you make sure you do a proper testing for your workers, food handler. They call it food handlers. When I was still working in the government hospital, then we call it the food handlers test. Lagos State used to send them for food handlers test then. Now, I was about to talk about the risk factors. People who are at risk are, one, people who are traveling to endemic countries. Where are the endemic areas? Southeast Asia, where they have the highest incidence of typhoid fever in Southeast Asia. Now, Sub-Saharan Africa, which we are in, also has a high incidence, but maybe not as high as Southeast Asia. So people who are traveling to Southeast Asia or Sub-Saharan Africa, you know, are at risk. Professionals, healthcare providers, doctors, nurses, laboratory technicians, laboratory scientists who handle stool samples, who treat patients with typhoid are at risk. You understand? And thirdly, people who live in highly populated areas that have low access or zero access to potable water. Okay. They are also at risk. Now, there are a few things I also want to mention. Like I said earlier, there is typhoid fever, and there is also a similar kind of fever caused by another member of the Salmonella family. They call that paratyphoid. They are two different diseases. Now, there's also a disease called typhus. Typhus is not the same thing as typhoid. Typhus is spread by insects like lice, house lice, and fleas from dogs and cats and co. That one is also deadly as well. That one is different from typhoid.
Okay. Yeah, so. All right, thank you so much. I guess we've had a great time listening to you today, talking about all of these things. Many thanks to you for coming on the show.
Yeah, I'm glad I was part of it.
Well, we've been speaking with Dr. SAMSON SHONOWO, the Medical Director, SHONOWO Hospital. And now it's a wrap on the show for today. Thank you for staying with us. I am Perpetua Fasami Peter. Bye for now.